This is Dr. Robert Troell talking about facial implants. What are the advantage over other alternatives? The other alternatives are temporary fillers, such as hyaluronic acid. There are a long-term filler, Bellafill. There is facial fat transfer. The last one, which we'll be talking about the advantages of, facial silastic implants. So silastic implants are excellent because they're reversible. You can put them in if you don't like them, which is very, very rare. You can take them out. Matter of fact, for the implant to the face, I've never had to take one out, except for one who had chronic pain, but none for aesthetic reasons. For the chin, I've never had to take that out, except for one patient that had an implant that I needed to remove it. So the advantage with these implants is they're reversible and they're permanent. So the patient satisfaction rate that we have is between 96 and 98%. So revision surgery is potential, but that's usually between 2 and 4%, that either there's a slight asymmetry or people want additional volume, such as putting a filler in, such as Bellafill, which is a permanent filler. So specific advantages, we'll start from the top, work our way down. What's the advantage of a temporal implant? Well, in that area, there's a lot of arteries and veins. Injecting that with a filler has higher risks of getting significant complications. Plus, the amount of volume you need, a temporal implant's the size of about 5 to 7 syringes of a filler. So it's actually more cost effective by putting that in. Plus, this area tends to be kind of constricted. So the advantage with the implant, it can lift a constricted envelope, such as when people have acne scarring. Some people have acne scarring on the face. The implant can push out a constricted envelope. Bellafill is the only filler FDA approved for acne scarring. That still doesn't distend the skin. It fills in areas of volume deficiency. So the midface, the only technique to lift or suspend the midface is using a implant, either malar, submalar, or combined implant that actually lifts the face. Why? You have some ligaments inhibiting the face from being lifted. Putting an implant in lifts those osteocutaneous ligaments up, and you get a mid-face lift at the same time. It improves your jowl, the nasolabial fold, the volume loss in your tear trough, and gives you volume to the mid-face. The only procedure, if you use fat, temporary filler, or Bellafill, a permanent filler, you don't get that lift of the mid-face. It might appear lifted, but it's not actually lifted. The chin. Putting an implant in the chin is the only method of volume replacement that pushes the soft tissue out with the least amount of getting a deformity. In some patients who want a complete mandible implant from the angle all the way across, it's a very powerful implant that gives you a nice mandibular line. Models such as Angelina Jolie have an excellent mandibular line. So facial implants have a significant advantage over other volume replacement options such as fat or fillers. If you have any questions, please contact my office by email or phone call.